Welcome to all. Today we are going to see one important topic in the field of psychiatric nursing, that is therapeutic nurse-patient relationship. This is very important because when we interact with our patient, maybe for example the initial interaction or how we work together with the patient, how it is going about, everything is depending upon the way we interact with them, and the do's and don'ts what we do during this interaction is very important. To understand this, we are going to see today about therapeutic nurse-patient relationship. At the end of the class, the students will be able to define therapeutic nurse-patient relationship, enlist the factors determining therapeutic nurse-patient relationship, identify the phases of therapeutic nurse-patient relationship, and explain the tasks of nurses in each phases. Understand about therapeutic impasses and how to overcome these impasses. To understand what is therapeutic nurse-patient relationship, we have to understand this is a fundamental component of quality nursing care. It helps us to build trust, enhances communication, and improves patient outcomes. So based on mutual respect or empathy and professional boundaries, these are the important factors we have to keep in mind when we are discussing about therapeutic nurse-patient relationship. We will see these aspects in detail later. To define therapeutic nurse-patient relationship, it's a planned, purposeful interaction between two human beings, especially when we say in the ward, it's between the nurse and the patient. So it's always a planned, a purposeful interaction between the nurse and the patient. And the nurse uses personal attributes and clinical techniques in working with patient to bring insight and behavioral changes. Because we know through communication only we can do this change behavior or their thoughts, whatever. That's possible only through communication. What are the factors determining nurse-patient relationship? The first one is rapport, empathy, warmth, and trust. We will see these factors in detail. What do you mean by rapport? This is a relationship or communication with the patient. That means how good you can maintain a relationship, a talking relationship with your patient. How much comfortable you and your patient is in your communication or in your relationship. How much freely you can talk to them or how much approachable you are. How much free your patient is to come and approach you for any kind of need or help they need. So this is a kind of how much in-depth relationship you have with your patient. Acceptance and willingness to involve with the patient. So initially it is a part of your responsibility as a nurse to accept your patient or to be willingness to involve in the patient care. And there is mutual understanding and growth. When you have a good rapport with your patient, there is always a scope for mutual understanding and growth. Next is empathy. What is empathy? We always feel sympathy towards someone who is suffering. But to feel the empathy towards the patient, it's something more. That means you have to put yourself in the shoe of your patient. That means you have to be putting oneself in the patient situation while maintaining the professional boundaries. So when you are having empathy towards your patient, you will be able to feel or sense your patient's anger, fear or confusion as if they are your own. Now what is warmth? This is the ability to make patient feel comfortable. How much comfortable you can be with your patient or how much comfortable your patient will feel in your company or in your presence. That's what the warmth word meaning. Acceptance of patient as unique individual. So in order to make the patient feel warm in your relationship, you have to accept the patient as a unique individual with whatever flaws he has, whatever problems he has, whatever symptoms he is showing. You have to accept him as a unique individual. Willingness to be involved with the patient. You have to be involving genuinely. Patient should feel that you are genuinely there to help him or her in her problems, finding solutions or suggesting solutions. So this is how you make your relationship warm. Trust. a firm belief in the reliability, truth, and integrity of the nurse. This is not easy to develop in one interaction. This is consistently you have to make your patient feel that you are reliable, you are truthful, and you are not going to put him down. You are there to support him, or you are there to be with them whenever he is finding it difficult to adjust. So this trust is the cornerstone of nurse-patient relationship. Unless and until there is trust, it's very difficult for the therapeutic nurse-patient relationship to develop. So this is the foundation of a strong therapeutic relationship. Now we will see what are the goals of nurse-patient therapeutic nurse-patient relationship. First one is to establish trust and rapport. So you have to use your therapeutic techniques, your communication skills, your interaction skills in order to maintain or make this trust and rapport with your patient. Support emotional and psychological well-being. So throughout your relationship or throughout your communication, you have to ensure that you are supporting your patient emotionally and you are making sure that your patient's emotional or psychological well-being is taken care of. Encourage patient participation in care. So when you are talking to your patient, you are communicating with your patient, you have to encourage him to be more active in his own care. What are the problems you are identified? What are the problem patient has identified himself? What are the possible solutions? Which solution is the best? Or which are the steps he has to take? What all he has to keep in mind? What all things he has to take care of his life? Everything is depending upon how best you can convince your patient to involve genuinely in the patient care, in his own care. Facilitate healing and recovery. How much you can facilitate in the healing or fast recovery of the patient, or to encourage him to do the change in behavior what we are expecting him to do, or to get discharged at the earliest from the ward and to get adjusted in the society with whatever minor problems he has. So that's how you facilitate in healing and recovery through the nurse-patient relationship. Next, we are going to see what are the phases of therapeutic nurse-patient relationship. There are 4 phases: the pre-interaction phase, orientation or introductory phase, working phase, and termination phase. The first phase is pre-interaction phase. This phase begins before the actual interaction with the patient. That means when the patient gets admitted in the hospital, you are going to meet him for the first time. The phase between you take up the case and meet the patient for the first time, the time between that is the phase called as pre-interaction phase. What all things will be going on in your mind, how you are going to meet the patient, what are the things you are going to get prepared before meeting him, how many records you are going to check, how much data you are going to collect before meeting your patient in actual, maybe from the previous duty staff or maybe from the relatives or from the patient's chart. So in this phase, patient is assigned to the nurse. You know you are going to get this particular patient, you are going to meet him, and the nurse feels fears and misconception before interacting with the patient. This is very natural. Before meeting any patient, you will have your own worries or doubts whether the patient is going to accept you or not, he is going to open up his problems or not. So you feel kind of fear or misconception before interacting with this patient. So what are the tasks we have to get in this particular phase? First one is obtaining information about the patient from secondary sources like files, the case file, relatives of the patient, or from any other healthy members who have cared for him in the previous shift. So you get a clear picture about your patient's condition, what are the things you have to keep in mind. So you will have some idea before going to meet the patient for the first time. Explore your own feelings, fears, and anxiety. So first, before even meeting the patient, you check yourself whether you are confident, whether you are anxious, or you have any fear or any worries about the interaction. So first, you have to prepare your mind, get enough data. After collecting the information, you plan to interact with the patient and have your objectives of the interaction phase in your mind clearly defined. The nurse may experience anxiety in interacting with the new patient. That's very normal. Feelings of inadequacy may be there. You may feel that maybe you are not well prepared or something is lacking. That is also quite natural. And you may think that patient may hurt you, your feelings, or in a way he may try to hurt you. This kind of worries will be there in your mind, but you have to overcome that and you have to be mentally stable before interacting with the patient for the first time. The second phase is introductory or orientation phase. So in this phase, you are going to interact with the patient in person for the first time. So the primary concern of the nurse here is to assess the patient's condition and to focus on identifying his problems. So this phase, you try to talk to the patient, initiate the rapport, try to get into his ideas or whatever is there in his mind, and try to identify the problems, the presenting chief complaints of your patient. What are the tasks in this phase? First one, establishment of the contact with the patient and develop a rapport. This is your primary task. You have to maintain your rapport with your patient in order to get more details from him, in order to make him comfortable, in order to make him talk to you comfortably and collect maximum information, the subjective assessment, your objective assessment, everything should happen in this phase. And you try to find the problems, the diagnosis, the nursing diagnosis of your patient. So gather information from the patient and define the nursing needs, set priorities for your intervention. So in this phase, you are identify, maybe it may not be one interaction, it may be multiple interaction, maybe you collect the data, how much is required to identify the patient's problems and making short-term or long-term objectives. The third phase is working phase, where you are actually working on your patient's problems. So this phase starts when the nurse and patient are able to overcome the barriers of orientation or introductory phase. There is a clear rapport between you and the patient. The patient has trust on you to share his problems freely with you, and they actively work in fulfilling the goals which they have established. So you have to involve your patient in this phase and get the work done. So the tasks for these phases are: the nurse collects history from the patient and identifies nursing needs of the patient, and she encourages the patient to communicate so that he is able to find an alternative to his or her problems. So in this phase, a patient will be able to identify his own problems, will list down, will prioritize, and he will identify what are the possible solution with the help of the nurse. Provides information needed to understand and change behavior, and take actions to meet whatever is required to meet the patient's requirements or needs. The fourth one is termination phase. Termination of relationship may occur for a variety of reasons, such as the goals are already established or attained and patient may be getting discharged. So there are various reasons why the termination phase has come already. The tasks are summarizing the course of interaction. So in this phase, you will summarize whatever you did with the patient, positives or negatives, you will be able to summarize. Exploring the future plans. So you collect a kind of feedback from your patient and ask him what he is going to do in the future, like after moving from your ward or moving from the hospital after discharge, how he is going to manage his life, what are his short-term or long-term goals, and how he is going to cope up with that problems. What are the strategies he is keeping in mind? And exploring feelings about termination of therapeutic relationship. What he is feeling. Sometimes patient may feel very much anxious or worried or fearful. He may think that without the support of you, he may not be able to find a proper solution. He may have 100 questions in mind how he is going to adjust in life, or what are the solutions for the problem what he is going to face in the society. So you have to give him a clear-cut idea how or which way he can tackle those problems, what are the strategies he has to follow, and what are the available facilities what he can use after discharge. You can also recommend him to approach some agencies, some voluntary organizations who will be providing help for such patients. So these are the kind of actions you can do in order to prepare your patient for the termination phase. After this, we are going to see, when we say therapeutic nurse-patient relationship, we have seen the different phases. And we know that rapport or your communication is a major role, or is having major role in this therapeutic nurse-patient relationship. Now, we also should think of some roadblocks in this relationship, which will act against development of trust, development of rapport, or development of your strong nurse-patient relationship. These blocks are called as therapeutic impasses. So, therapeutic impasses are the blocks in the progress of nurse-patient relationship. The impasses provoke intense feelings in both the nurse and the patient, which may range from anxiety and apprehension to frustration, love, or intense anger. So, if any kind of these kind of emotions are developing in the nurse's side or from the patient side, it may work as a blockage in your relationship. So it may be a positive one where the patient may feel love, or you may feel a kind of more affection towards your patient, or it may be a kind of anger or frustration towards your patient, or vice versa. There are different types of therapeutic impasses. The first one is resistance, second one is transference, third one is counter-transference, and fourth one is boundary violation. We will see each one of this in detail. The first one is resistance. Resistance in therapeutic nurse-patient relationship is the patient's reluctance or avoidance of verbalizing or experiencing troubling aspects of oneself. That means the patient feels uncomfortable to reveal few informations or to reveal his own problems in front of the nurse. So he may try to avoid meeting you, or may try to avoid interacting with you, so that he don't have to reveal himself or reveal his problems in front of you. So this is the patient's reluctance or avoidance of verbalizing or experiencing troubling aspects of oneself. This term was introduced by Sigmund Freud, which means the patient's unconscious opposition to exploring or recognizing unconscious or even preconscious material. When he did free association, whenever patient put a pause or stopped suddenly or changed the topic suddenly, it means that there is some blockage in that particular topic. So whichever topic was shown resistance, Freud used to work more on that, used to dig more on that area to find out what are the problems, what are the underlying problems which happened during that particular area. So same way here, this is caused by patient's unwillingness to change when the need for change is recognized. So when in your working phase, when you are telling the patient he may need to change his particular behavior, maybe he don't want to change it, or he is not comfortable to change it, that could be one reason why he may be showing this resistance to come and talk to you, or to come and or continue the relationship with you. It usually happens in the working phase because the greater part of problem solving process occurs during this phase. Because a lot of his problems, sometimes he may not be aware that that problem was existing with him or with his behavior. So when you ask him to modify that particular behavior, he may feel tensed or anxious about it, and he may try to avoid talking to you or interacting with you. It's kind of resistance that is shown by the patient. This also may be a reaction by the patient to the nurse who has moved in too rapidly or too deeply into the patient's feelings, or who has intentionally or unintentionally communicated a lack of respect. So this is another problem which can happen in our communication. What we do a mistake is when we are talking with the patient, we may move too fast or in too depth without his proper or without checking his comfort level. It may be some private matters which he don't want to share so openly or so fast with you. Maybe he needs some more time to share those details with you. But you didn't have the patience to wait that much time. You might have moved too fast, and then he will show you this kind of resistance where he will tell you indirectly that I am not comfortable to share this information with you. or sometimes you may move too deeply, which he don't want, or he is not yet comfortable with you to share those very sensitive matters. So you have to give time, you have to be patient in not to wait for patient to be comfortable sharing informations. Or sometime what happens, intentionally or unintentionally, we might have communicated a lack of respect in our talk with your patient. You may not be aware, maybe some matter, or you didn't pay close attention to what he was telling, or you might have ignored what his concern was. This can be interpreted as a lack of respect by patient, and he may start showing resistance in your therapeutic nurse-patient relationship. So this is very important. Next one is transference. This therapeutic impasse is an unconscious response in which the patient experiences feelings and attitudes towards the nurse that were originally associated with other significant figures in his or her life. So what happens, they may compare you with someone whom they know already in their life, and the similar feelings what they have for that patient may come towards you. It may be positive, it may be negative, but that will be affecting as a blockage in your relationship. This may be triggered by the superficial similarity, maybe your facial features and that particular person's facial features are same. It may be the manner of speech, or it may be the personality style or your trait. Anything could trigger these kind of feelings. Patient will start comparing you with that particular person. So transference reduces self-awareness by allowing the patient to maintain an inaccurate view of the world in which all people are seen in similar terms. What we have to be careful here is when he starts feeling this transference feelings towards you, he is losing the reality orientation. So it's very important to make him oriented to the reality, and you have to make him understand you and that particular person with whom you are compared to is not same. What is your role, in which way you will be helping him, that should be very clearly told to him. The transference reactions are harmful to the therapeutic process only if they remain ignored or unexamined. So whenever you feel the patient is developing transference towards you, you have to be very careful to clarify the roles and responsibilities immediately, instead of allowing him to continue those kind of feelings. There are types of transferences. The first one is hostile transference. So here again there are two types. When this hostile transference is internalized, the patient, the anger or the hostility towards you is internalized. How he will show this is maybe through depression or discouragement. So this will be expressed as depression or discouragement. He don't want to talk to you, he may avoid you. The second kind is when the anger and hostility is externalized. What he will do? The patient will start becoming critical towards you, defiant or irritable, and may express doubts about your training, or he will ask or question your knowledge, question your skill, will try to put you down, or you will try to make fun of you or mock you. This kind of feelings will be expressed when he is externalizing this kind of hostility or anger. The second type is dependent reaction transference, where the patient will become dependent on you. This is characterized by patients who are submissive, subordinate, and who regard the nurse as a godlike figure. They will be completely submissive to you. Whatever you do, whatever you say, he will do. He will be always following you. He will be considering you like a god figure. This is also not correct. You shouldn't be encouraging this, because again they are losing the reality orientation. In this reaction, what is the dangerous one is they will start expecting things from you according to the feelings what they have towards you. So in this reaction, the nurse must live up to the patient's overwhelming expectations, and when it doesn't happen, they will feel again depressed, or they will feel angry towards you. How to overcome this impasses? You have to be very specific and clear about the goals, the purposes, and the roles of nurse and patient. Whenever you feel this kind of impasses are developing in the patient's mind, you have to clarify your role and what you will be able to help him, in which are the areas you will be helping him. That has to be very clearly told to him without any confusion. You have to listen to the patient. You have to ask him why he is feeling so. In whichever way he can come out of this problem, you have to help him. Clarifying and reflecting feelings. Always try to clarify what is the feeling in his mind and reflect on whatever behavior he has shown or whatever he has spoken. The third therapeutic impasse is the counter-transference. Counter-transference is a therapeutic impasse created by the nurse's specific emotional response to the qualities of the patient. So here, instead of the patient feeling for the nurse starts having a kind of feelings towards the patient. Basically, because like how the patient had transference, similarly we may have counter-transference feelings towards the patient. So these reactions also may be very intense love or caring, disgust or hostility, anxiety often in response to the resistance by the patient. It could be anything. But you have to be aware of yourself, whether the counter-transference, whenever it is developing, you have to be aware of it. And you have to take immediate measure to remove that. So the last one is boundary violation. This is very important therapeutic impasse, which occurs when the nurse goes outside the boundaries of the therapeutic relationship and establish a social, economical or personal relationship with the patient. When we forget our responsibilities or roles and we do beyond that whatever we are supposed to do, then it comes under the boundary violation. Now, which are the boundaries we may tend to violate? First one is role boundaries. When you are in the ward to take care of him as a staff nurse, instead of that you try to act like his mother or you try to act like his sister or try to do something more than your role, then it becomes a role boundary violation. Time boundaries. When you spend too much time on one patient instead of spending equal time with every patient, or you tend to, even if it is not required, you are spending too much time on caring him or talking to one person, that shows the time boundary violation. Place and space boundaries, where you are not supposed to meet the person. Maybe for example, when you are in the hospital, you may meet him in the ward, but you are not supposed to meet the patient outside the hospital. That will be another place boundary. Or the space, how much space you maintain between you and the patient. Because this is a therapeutic nurse-patient relationship, we have to be conscious about the space boundaries. Money boundaries, spending for him or helping him financially, or maybe collecting some money instead of giving some service is also a boundary violation. Gifts and service boundaries, something which is out of your way you are helping or you are gifting or you are accepting any gift in return, this is again a boundary violation. Clothing boundaries, when you are exchanging clothes or buying clothes for the patient. Self-disclosure, how much you have to disclose in front of the person. Sometimes you may have to mention some of your life incidents in order to make the patient comfortable, like maybe to find some solution, like how you have overcome similar situation. Same way, why can't he try the situations? You may be telling some incidents in your life, but that doesn't mean that you will be expressing more than what is required. You may be disclosing more than what is required to the patient, especially your personal details, your relationship problems or your financial conditions. This kind of self-disclosure is not entertained and it is considered as boundary violation. Post-discharge social boundaries. After the discharge, again you are continuing the relationship with the person. If it is not professionally and you are continuing the personal relationship with the person, is considered as post-discharge social boundaries. And any other type of things you are doing for the person other than the required one is considered as boundary violation. To summarize, the therapeutic nurse-patient relationship is a professional, goal-directed connection that promotes patient's well-being and recovery. So we know this relationship is purely professional and it has some purpose or goals, and it is goal directed connection that promotes patient's well-being and recovery. Our only target is to help the patient for his well-being and recovery. It is based on key principles such as trust, empathy, respect, and professional boundaries. These factors you have to keep in mind always, and you have to be careful that you are not doing anything that will cause any problems in these areas. You are not going to break his trust, because once it is broken, it is very difficult to build again. And the empathy, where you make the patient comfortable and you feel for the patient as his problems are your own. And the respect, even though they are a patient with mental illness or mental problems, you give him the same respect what you expect from others, and give care, or you interact or you make a relationship with that respect is very much appreciated. And lastly, the professional boundaries, what you have to keep in mind whenever you are interacting with the patient. So the relationship progresses through 4 phases. Pre-interaction phase, where we said this is before meeting the patient, what all preparations you will do. And the second phase of orientation, where you will talk to the patient for the first time and will try to understand him and his problems. And the working phase, where you will start working on the patient's problems. You start listing down the problems, the objectives, and your possible solutions, and you may suggest the best solution for him, and you work along with the patient in this working phase. And lastly, the termination phase, when the patient has found solutions for most of his problems and is ready for discharge, you will be preparing him for adjustment or adjusting in the society. So this phase, the termination phase, will be targeted towards preparing him to live independently in the society. And the nurses have to overcome the impasses. How much you have the self-awareness, how much you are aware about the impasses that is developing in you or in the patient throughout the nurse-patient relationship, and how best you can help him, yourself and the patient, to overcome these impasses is very important. To conclude, therapeutic nurse-patient relationship is very essential for quality nursing care and practice, and it requires continuous effort, skill, and self-awareness. And it leads to improved patient care and professional satisfaction. I hope this class is clear. Thank you.